Hi everyone, my name is Rachida Pukiajima, and today I'll be presenting to you my system, which is the RC Health Service. This time, we are making health delivery service accessible to everyone. Before we proceed, I'll be taking you through these main points: the introduction, background, challenges I faced whilst gathering knowledge to build this system, major decisions I made, my research methodology, and then I'll show you sample pictures of my prototype as well as a conclusion. It is undeniably a fact that access to proper healthcare delivery system is important. As the world continuously adapts technology for most activities in recent time, like agriculture, education, and many others, it is also important that healthcare delivery system is not left behind, but rather made accessible to everyone, irrespective of their location. So this is what RC healthcare system is here to solve. My problem statement is that inadequate access to good healthcare delivery services in Ghana. This is the problem. So, in the problem I'm trying to solve now is inadequate access to healthcare delivery services in Ghana. For the solution, it's a system or a software application known as the RC Healthcare Service that is going to enable patients to connect with the health personnel and then interact with them remotely. Individuals or patients can equally book appointments with doctors before visiting the hospital. So, because of this, you are going to save time and then you are not going to join a long queue. Inside this system is an embedded menstrual tracker to help ladies track their menstrual cycle. And then also when the patient's phone come into contact with the doctor's phone, all health related information are directly transferred to the doctor's phone. So in a situation where the doctor or the sorry, in a situation where the patient cannot communicate with the doctor about whatever is happening to them, when the patient activates the application on his phone and then the doctor equally does same, all health information are directly transferred to the doctor's phone. Also, history of the patient's last visit to the hospital is equally transferred to the doctor's phone. So this is an interactive system that enables patients to book appointments and then equally have their information transferred to a doctor if the need arises. So moving on to the background information. After careful research, the plan was to build a mobile application where patients or users could log on to the system, book an appointment to the doctor before going to the hospital, interact with any doctor available, connect to a specialist, and then track their menstrual cycle. But after careful consideration and then consistent interaction with other users of the system, I had to consider people without smartphones. How were they equally going to access this system, the functionalities of this system, and then meet the larger community as the system plans to do? So I came up with these two personas. The first one, which is Muna, who lives in the northern part of Ghana, has not been well for some time now or for some days now, but then she's unable to visit the hospital due to her work. Although she does not have a smartphone, she wishes a system could help her connect to the doctor while she's at home. For my second persona, Marie has challenges tracking her menstrual cycle and hence she embarrasses herself whenever it is that time of the month. She needs a system that can help her track her menstrual cycle and communicate her mood for advice. So this is what the system seeks to solve. Throughout the design process, these were the three major challenges I faced while building the system. The first was research, the second was improving upon functionalities, and the third was designing two prototypes. So, research, information gathering, analyzing data to help address the right problem. There are already solutions for this problem, so trying to find the right solution and then from users was quite challenging. I had to do a lot of research and then find the right information. Functionalities, improving upon already existing systems and then introducing new functionalities was also something I had to think very well because there are already applications where people can book slots and then have one-on-one interaction with doctors. There are also systems where people can use to track their menstrual cycle. So what was I doing? This time I'm trying to put together two systems. A system which will allow users to book appointments connect with a doctor, track their menstrual cycle, and an extra functionality where when the patient's phone comes into contact with the doctor's phone, information are directly transferred. So improving upon already existing systems and then introducing new functionality required extra work for me. Also, designing two prototypes. So the USSD application for people without smartphone and then the mobile application for people with smartphones was also quite challenging because I had to consider what smartphones could do and then what other phones could also do. So it was not easy trying to find the right functionality for these two systems. So moving on to the major decisions I considered while building the system. The first was the interaction design, and then the second was the design architecture. For the interaction design, I was looking at a system which was more user friendly. So I was also considering the design principles, which is recognition rather than recall. So a system where users will be able to interact with the system because it has less text and then more images to enhance recognition rather than having to recall. So these images are self-defined images that will represent actual activities. So there will also be a chat box to allow users to interact with the system, and then they'll automatically be assigned to health personnel if the situation becomes serious. So this was an easy to use application where users can navigate through the system. Secondly, I'm also looking at the design architecture. So the data on the system will be organized, categorized, and then prioritized based on the user's needs and the objectives of the system. The structure and layout will be flexible and information will be shown in a way that the user will be able to understand. So considering the design process, this time I'm also looking at flexibility and efficiency of use of this system. Thank you. So this slide shows the layouts of how the system is going to be. So the first one is a mobile application on a smartphone where it's going to be user interactive with images to help the user navigate through the system. And then the second image here is the USSD device. So it will allow you to, so far as you've registered, it means your record has already been recorded or your information has already been recorded. So you will be asked to enter your PIN and then you carry it on from there. So the prototype video will show how you'll be able to use both systems. For my research process, I considered the joint application development method under the agile approach. This because it allows users or key users to participate effectively in the process, and the results that were generated through this process are more accurate when the system is properly used as compared to other application development approaches. And then this development process relies heavily on prototype and then involves the user more frequently. It is an interactive process and then it continues until the system is completely developed. Although the system is more expensive when the group is large, it produces a functioning information system. So this is why I decided to go with this system. So thank you very much for staying through to the presentation. I hope you enjoyed it.